The next thing I'm going to discuss is the importance of providing as much detail as possible within the template before you submit a case. I've gone ahead and selected a general adult history template, and when you open that up, this is what you're going to see. It is first going to ask you for vital signs. Vital signs are very important to include. Things like temperature, the pulse rate, the blood pressure are all going to give the physician who is consulting on this case information about how critical and how ill your patient is at this moment in time. You have to remember, these physicians are providing treatment guidance and diagnosis on patients that they will never see, speak to, or examine. This is very difficult, and they can only do this if you give them all of the detail that they need to come up with the information to respond to you. Next, we're going to move down and we're going to go into the top 2 questions within the template. What is the most concerning problem for the patient, and describe when and how this problem developed. We suggest that you use these top 2 questions to really paint a good picture of the patient that's sitting before you as you treat them and start their care. Please give a great history about how long this problem has been going on. How did it develop? What are all of the symptoms that the patient is concerned about? Why are they concerned? What are they feeling? What is happening to them? This is a great place for you to include all of that information. Then going down is when you're going to continue to answer questions about the patient's HIV status, tuberculosis, weight loss, all important things to understand how ill a patient is and what type of physician is needed for their care. Now we're going to go into symptom selection. So as you can see, the top symptom that's asked is, does this patient have any breathing difficulty? For the purposes of this video, I went ahead and selected yes. You can see that then when you select yes, it asks you a number of other questions about the patient's breathing. You don't have to answer all of them, but answering as many as possible with as much information as you know if this patient does have breathing difficulty is very important, because it's again going to give the physician as much information as possible to come up with reasons why this patient might be having breathing difficulty and how we could help the patient. As you can imagine, if someone simply says yes to this and then doesn't include any additional information, that's a very broad statement to make, and breathing difficulty can be caused by many different problems. And so a physician is not going to be able to reach a diagnosis or treatment plan without that specific information underneath breathing difficulty. Breathing difficulty is just an example that I'm using, but this goes for any other symptoms that you select yes under the template, whether it be chest pain, abdominal pain, seizures, fever, diarrhea, or anything else that you are given the option to select. Please then go underneath those symptoms and provide additional information. Another issue that can happen from time to time is that in the top of the template, you're going to list a number of symptoms that the patient is complaining of, but then underneath, where you have the opportunity to then provide detail about those symptoms, they aren't listed with any detail or even selected in the remainder of the template. So please go ahead and ensure that any symptoms you are concerned about with the patient, you go ahead and select, and then answer whatever questions you are able to answer about those symptoms. Just give the information that you have, that you know, that the patient is able to tell you, and then that will ensure that the physician who is viewing this case is able to really respond to you quickly and is able to give you a thorough response that is very helpful.